you've graduated, you've passed your board exams. Then you want to know, how do I get my job? How do I set up for day one? How do I market? How do I be with my patient? And then the fourth stage really is, how do I refine my skills? This is a method that I've created over the years. I've been in practice 20 plus years, and really it's going to make your diagnosis so much faster. I'm going to show you how to make a very fast diagnosis. In fact, as soon as a patient walks in, what are you feeling off of them? All your senses should be lit up so you can start getting your diagnosis right there. Learn how to sense, palpate, smell, ask, all this for the first time in a sense, and then you combine that with your college knowledge, and I'm telling you, you're going to be so accurate with your diagnoses. I'm going to do full demos for you. We've got two amazing volunteers here today, and I'm going to be showing you on two different body types how to find these things, how to look at these things. Very key here, you do not leave the room until you notice a bit of a shift in that meridian, and that's when you know you're going to get a result. This is now what I would call, if she had knee pain, a guaranteed result. I just don't know how much. Using pulse to find your needle depth, using pulse to know when to stop needling, using pulse to know when to take your needles out, using pulse along with needle techniques. I mean, it's amazing what it will tell you, and this will start your journey on teaching yourself pulse in a sense. Not only that, but getting much better results. You're going to be absolutely shocked on how much information you can garner just from these small techniques. None of these courses are complete without the end being a full demo of everything. We'll take it all in, and I'll show you the run through in real time. Okay, so you can see this does not take long. In fact, it's incredibly fast the more you do it.